Lupus, also known as systemic lupus erythematosus, or simply abbreviated as SLE, is a complex and chronic autoimmune disease that affects various parts of the body. It is characterized by the immune system's malfunction, which results in the production of autoantibodies. These antibodies mistakenly attack the body's own tissues and organs instead of fighting off infections or foreign invaders. The symptoms of lupus can vary from person to person and may come and go in what are often referred to as flare-ups. Skin rashes are a hallmark of lupus. The most well-known is the butterfly rash, which appears as a red or purplish rash across the cheeks and nose. Other skin issues can include discoid rashes, photosensitivity, and mouth or nose sores. Overwhelming fatigue is one of the most frequently reported symptoms of lupus. This extreme tiredness can be debilitating and often does not improve with rest. Lupus commonly causes joint pain and swelling, often resembling arthritis. It typically affects the small joints of the hands, wrists, and knees. A persistent low-grade fever is a common lupus symptom, often associated with inflammation and flare-ups. Hair loss can occur, and it may be patchy or more widespread. This can be distressing for individuals with lupus. Lupus can cause Raynaud's phenomenon. In this condition, fingers and toes turn white or blue when exposed to cold or stress, often followed by redness and throbbing as circulation returns to normal. Lupus can affect the kidneys, leading to symptoms such as dark urine, increased or decreased urination, and swelling in the legs and ankles. It can cause inflammation of the lining around the heart, also known as pericarditis, and the heart itself, also known as myocarditis. This can result in chest pain and potentially serious heart complications. Lung issues in lupus can manifest as pleuritis or pulmonary hypertension, leading to chest pain and breathing difficulties. Some individuals with lupus may experience neurological symptoms, including headaches, seizures, memory problems, and mood disorders. Lupus can cause abdominal pain, nausea, vomiting, and diarrhea. Blood abnormalities, such as anemia, leukopenia, and thrombocytopenia, are common in lupus. Enlarged lymph nodes may occur, especially during active disease phases. Ulcers in the mouth or nose can be painful and are common in lupus. The exact cause of lupus, or systemic lupus erythematosus, is not fully understood, but it is believed to be the result of a combination of genetic, environmental, and hormonal factors. Genetics plays a significant role in the development of lupus. Individuals with a family history of autoimmune diseases, including lupus, are at a higher risk of developing the condition. Hormones, particularly estrogen, seem to play a role in lupus. This is evidenced by the fact that lupus is more common in women, especially during their childbearing years. Hormonal fluctuations during pregnancy and menstruation can influence the disease's activity. Some research suggests that male hormones may have a protective effect against lupus, which could explain why the condition is less common in men. Exposure to UV light from the sun or artificial sources is considered a potential trigger for lupus, particularly in individuals with photosensitive skin. Viral or bacterial infections can sometimes activate the immune system and trigger lupus in genetically predisposed individuals. Epstein-Barr virus is one infection that has been linked to an increased risk of lupus in some cases. Certain medications, particularly those associated with drug-induced lupus, can trigger lupus-like symptoms in some individuals. In lupus, the immune system loses its ability to differentiate between the body's own healthy tissues and foreign substances, producing autoantibodies that attack healthy cells and organs. This abnormal immune response is a central feature of the disease. Research has shown that abnormal activation of toll-like receptors, which are important in the body's immune response, may contribute to lupus development. Changes in gene expression due to epigenetic modifications, such as DNA methylation, can influence the development of lupus. These changes can be triggered by environmental factors and may affect how the immune system functions. Lupus has various forms and manifestations. These types of lupus can differ in their impact on the body and specific symptoms. We'll discuss the four main types of lupus, each with its own distinct characteristics and effects on the body. Systemic lupus erythematosus is the most common and severe form of lupus. It is a systemic autoimmune disease, meaning it can affect multiple systems and organs throughout the body. Symptoms can vary widely and may include joint pain, skin rashes, fatigue, fever, and organ involvement, affecting organs like the kidneys, heart, lungs, brain, and blood cells. Cutaneous lupus erythematosus primarily affects the skin and does not typically involve major organs. There are several subtypes of cutaneous lupus erythematosus. Discoid lupus erythematosus is characterized by chronic skin rashes or sores, typically on the face, neck, and scalp. Subacute cutaneous lupus erythematosus presents with skin lesions, often exacerbated by sunlight exposure. Acute cutaneous lupus erythematosus manifests as a malar rash on the face, similar to the butterfly rash seen in SLE. Drug-induced lupus erythematosus is a form of lupus triggered by certain medications. While the symptoms are similar to SLE, they are usually milder and often resolve when the medication is discontinued. Common medications associated with drug-induced lupus erythematosus include hydrolyzed, procainamide, and isoniazid. Neonatal lupus is a rare condition in which a mother's antibodies are transferred to her fetus during pregnancy or breastfeeding. This can lead to skin rashes, liver problems, or heart block in the newborn. It is generally temporary, and symptoms typically resolve over time. Diagnosing lupus can be challenging because it shares symptoms with many other conditions, and because the disease can present differently in each individual. A thorough medical history is essential. The healthcare provider will ask questions about the patient's symptoms when they first appeared, their duration, and any factors that may trigger or worsen them. Any family history of autoimmune diseases, particularly lupus, is also important to note. The healthcare provider will conduct a physical examination to look for signs of lupus, such as skin rashes, joint swelling, and other physical symptoms. They may also examine the patient's mouth, nose, and throat for sores, as these are common in lupus. Blood tests are a critical part of the diagnostic process. Several types of blood tests can provide important information. Complete blood count. This test measures red blood cells, white blood cells, and platelets. A decrease in any of these may indicate anemia, leukopenia, or thrombocytopenia, which are common in lupus. A positive ANA test is often an early indicator of lupus, although it is not specific to the disease. Many lupus patients have a positive ANA result. Anti-double-stranded DNA antibody test. These tests look for specific autoantibodies, such as anti-double-stranded DNA antibody and anti-Smith antibody, which are more specific to lupus. Anti-phospholipid antibody tests. These tests can detect antibodies associated with antiphospholipid syndrome, which is common in lupus and can lead to blood clots. Elevated levels of ESR and CRP indicate inflammation in the body. Complement proteins are involved in immune system function, and decreased levels can suggest lupus activity. Urinalysis. This helps assess kidney function and may detect protein or blood in the urine, which can be indicative of lupus nephritis, a kidney complication of lupus. If there is suspicion of kidney involvement, additional tests may be performed to assess kidney function, including serum creatinine and urine protein to creatinine ratio. In cases where there is concern about organ involvement, imaging studies, such as X-rays, ultrasound, or more advanced imaging like MRI or CT scans, may be used to examine affected organs, such as the heart or lungs. The treatment of lupus is aimed at managing the symptoms, preventing disease flares, and minimizing organ damage. Non-steroidal anti-inflammatory drugs like ibuprofen and naproxen are used to reduce pain, inflammation, and fever associated with lupus. They are often used for joint pain and mild symptoms. Corticosteroids, such as prednisone, are powerful anti-inflammatory drugs used to manage severe symptoms and flares. They can be taken orally, topically, or via injection. Prolonged use of high-dose corticosteroids can lead to side effects, so they are often used at the lowest effective dose and for the shortest duration. Hydroxychloroquine is commonly prescribed for lupus. It can reduce skin rashes, joint pain, and fatigue, and it may help prevent lupus flares. It has a good safety profile. Medications like azathioprine, mycophenolate mofetil, and methotrexate are used to suppress the overactive immune response in lupus. They can help manage severe symptoms and reduce the need for high-dose corticosteroids. Some biologic drugs, such as belimumab, have been approved for lupus treatment. These drugs target specific components of the immune system to reduce inflammation. In cases where lupus leads to blood clotting issues, anticoagulants may be prescribed to prevent clot formation. Sunlight can trigger or worsen lupus skin rashes. Patients are often advised to wear protective clothing and use broad-spectrum sunscreen to shield themselves from ultraviolet rays. It's crucial to avoid excessive sun exposure. Stress can trigger lupus flares. Techniques such as relaxation exercises, yoga, and mindfulness can help reduce stress and improve overall well-being. Regular, gentle exercise can help manage joint pain and fatigue. Physical therapists can develop exercise programs tailored to individual needs. A balanced diet can help manage inflammation and improve overall health. Omega-3 fatty acids and antioxidants are often recommended. Smoking can exacerbate lupus symptoms and increase the risk of cardiovascular complications. Quitting smoking is strongly advised. Patients with lupus require regular follow-up visits to monitor their disease activity and adjust treatment as needed. Blood tests, urinalysis, and imaging may be part of the monitoring process. Education about lupus, its symptoms, and management strategies is essential. Support from healthcare professionals, support groups, and counseling can help patients cope with the emotional and psychological aspects of the disease. SLE can affect various organ systems in the body, leading to a wide range of complications. These complications can vary in severity from mild to life-threatening. Some of the common complications associated with lupus include kidney inflammation, potential kidney damage, increased heart attack and stroke risk, lung inflammation and hypertension, neurological complications and mood disorders, anemia, leukopenia and thrombocytopenia, weakened immune system and susceptibility, rashes, ulcers and scarring, abdominal pain, nausea and vomiting, and osteoporosis risk. If you or someone you know is living with lupus, always remember that you're not alone. Seek support, educate yourself, and consult with healthcare professionals to manage this condition effectively. And that's all for this video. If you found this video informative and helpful, please don't forget to give it a thumbs up and share it with others who might benefit from this knowledge. To stay updated on more educational content about various health topics, remember to subscribe to our channel and hit the notification bell so you never miss an update. Thank you for watching. Until next time.